Hi everybody, welcome to Let's Talk Chiropractic. You know, John, about 30 years ago I started this show. So many people don't know what chiropractors do or they're afraid because I've heard of rough chiropractors. But today's show is going to be a good one, I mean it. I got a phone call from your friend. Eric called me and said, how old do you still see patients? Is there a limitation on age? And I said, it doesn't matter. The older the patient, the more gentle I am. So I never turned anybody away if they're 105 years old. So Eric, I guess, then I called you to come in. So tell first to everybody, who is John D'Angelo?
Me? I'm going to be an 82-year-old man. That's
Great.
who I am. Shortly. I've come in here with a very serious problem, and I was recommended with a friend of mine, which he had mentioned, Eric. And when Eric had come here that night, he had talked to the doctor, and the doctor called me from his office the night that Eric was here directly. So with that said, since then I have been doing nothing except increasing in my health, my pains, which right at this point I do not have, due to the fact of with this gentleman that's sitting right here that I'm facing, did such a good job because therapy was not helping me. I suggested to my doctor from the beginning that this was not helping. So I took it upon myself to go ahead and see doctor.
Good. Let's take a commercial break. Then we're going to tell his whole story. It's a beautiful story. So any of you that are elderly, that are afraid of chiropractors, you're not sure how Medicare works, come back in about 30 seconds. Thank you. You know, folks, I love being a chiropractor. I never believed in chiropractors. I always thought they were quacks 40, 50 years ago. And then I hear stories of how rough they are and how they hurt people. So I know you have doubts out there. But if you're getting older and your doctor's saying to you, live with your pain, you are arthritic, you are 80, 85, 90 years old, there's nothing anybody can do for you, I challenge that doctor's philosophy. Listen to John's story. He is a beautiful, active, productive man. But for 6 months, his pain was terrible. He did all that his doctor said, and he got worse. He took it upon himself through Eric's suggestion to come see me. And it's been great what has happened. So tell everybody, during those 6 months, what was your pain like, and what kind of therapy were you trying to get?
My pain was severe. Got to the point where I could hardly even move.
Yeah.
And I complained about it, but nothing seemed to be getting done about it. And as we're going right back to Eric again, and he had been here that night, and Dr. John called me right from here and never even knew me, and I did not know him. And since then, I'm able to get up and walk and move. It's something that I couldn't do for the last 6 months. I told my doctor about it, continuously complained about it. I even complained at the therapy that they were hurting me. I went in with pain. I came out with pain. 2 days later, when I went back for the next treatment, I was still the same. Nothing has ever changed until I started here, which a couple weeks ago back. And from the very beginning, when he went to line me up, I was already out of alignment by about maybe an inch, which is a lot. So this puts a lot of pressure on all points. And since the point of time when he put me into alignment, I have been doing very well. So I continue to come, and I'm almost at my end, I would think, because he's got me into that state where I'm capable of being on my own without the help of Dr. John. So I have got to thank him and my friend Eric for suggesting that I came here, which I my mind was made up already to the point I wanted to come to a chiropractor, but I was not afraid to come to the chiropractor, which a lot of people are afraid to come to the chiropractor, especially older people. They feel as though the chiropractors are what they call bone crushers, and this is what the doctors feel, and I feel as though the doctors are completely wrong. So if you have a doctor that is sending you for therapy, I suggest you come and see a chiropractor, and I would suggest coming and seeing Dr. John, because he has done a lot for me. In 6 months, I've been in so much pain, and the people that know me I couldn't even walk to the point I was in with a walker. But now I'm capable of getting up and walking. I'm doing fine, and I've got to thank Dr. John. And if you have any questions, and the other factor is people don't realize Medicare will pay for this procedure. And most older people do not know that, and your doctor doesn't tell you that. So what their connection is between the doctor and the therapist, I have no idea, but that's neither here nor there. The fact of the matter is, take it upon yourself, and I'm hoping you're watching this show right now, because I am living proof of what this man has done for me, and I am pushing the age of 82, which will be shortly. So I suggest, if you're having a serious problem with the lower back or anything into that position or way, I think you should call Dr. John and have a discussion with him like I had, and it worked out for me, and I think it'll work out for you as well, because, like I said, older people were being put on the burner, and they're just letting us go like we're nobodies anymore, but really we're somebody, and somebody should be fixed if it's a possibility to be done. And in my case, I'll recommend this guy any day of the week. I have no problems at all, and he's very soft and gentle, and he won't do anything you do not want to be done. He does not crack your bones, which he has not done to me, and he is so gentle, it's you'll be very shocked to just see how gentle he is. And this is what us older people need. You can go to these other chiropractors and they will crack your bones, which is not a good thing, especially on an older person. If it is, you're able to get hurt, and then you're never going to go back, and you're never going to trust them. In my situation, I trust them fully, 100%, and I think you should do the same thing. If you have a problem, especially older people, I'm going right back to that again. And the other factor is Medicare will pay for it, which a lot of people do not know. And the other factor is the older people are afraid because they heard so much about the chiropractor. I would suggest seeing Dr. John.
Thank you, John. And we're going to take a break soon, but you're going to see on the third segment of today's show what the adjustment is like. Mm-hmm. You know, some of you out there have been roughed up by some chiropractors. Don't think all chiropractors are the same. I thank God that Eric sent you here. You know, I think you could have went to a rougher chiropractor who would have made you worse.
Yeah,
I'm glad it worked out. So
absolutely.
Let's take a break, but we're going to talk in the second segment about why you could be gentle and still get results, and more about Medicare. You don't need a referral from your doctor and how many visits they do cover. So take a break, come back in a minute. Hey everybody, again, I'm Dr. John Degenhardt, a local chiropractor for 44 years now. I love helping people, John. I really do. I think health is so crucial.
I can see that, and I could tell just by the way you operated on me.
Well, I'm excited. When they see the simple leg check that I do, and that leg check is powerful. When you see how we adjusted you, John, many chiropractors don't do that leg check. They just crack away.
I went for therapy. Okay, let's start right there. The first thing they did was that, and they said I was perfect. Wrong.
True.
This was part of the problem. Now they're working on me, and all they're doing is hurting me, stretching me,
Yep.
when I was already out of alignment.
True.
So all they were doing is making it worse.
True.
I came here. The first thing he did was check. I was out almost an inch. An inch is a lot. It's like anything. Was he gentle? You better believe it. And I say it the way it is. I don't cut no corners.
Yeah.
He put me in alignment, and from that point on, it's been nothing but working down to the factor to where I am now. I could get up. I could walk. I could not do this. So who do I thank? Not the therapy, because they were hurting me.
Yeah.
I've got to thank Dr. John right here.
Well, and I thank the Lord that you got here, though, John.
Yes,
You know.
but you can't meet a nicer man. There's no ifs, ands, or buts about it. And he's very gentle. Very, very gentle.
Now let's talk about Medicare, though.
Yes.
Many people out there, they're on fixed incomes. You do not need to get referred to me. See, here's what you asked earlier. A patient has to get a referral from a medical doctor to go to physical therapy.
That's right.
You don't need to get a referral, though, to see a chiropractor.
Absolutely not, which I found that out.
And Medicare, as long as you're what they call in acute pain, they give you 18 visits, John.
Mm-hmm.
So a lot of our patients, if you're hurting, Medicare pays for it with a secondary insurance. So John comes, gets adjusted, whatever. It's been like maybe, 6 or 8 visits?
Somewhere
In the
right
past
around there.
month. Now he's fine. So we're going to discharge him soon. If it flares up again in a couple months, Medicare will cover it. Just to clarify, if a person says to me, I feel good, I want to come once a month for a routine maintenance, Medicare will not cover that. So either the patient has to say, I will pay cash for routine monthly maintenance, or they can say, I will just wait till it flares up and they call again. So again, how old do you have to be? You could be, John, 90. What would you say to an 82-year-old woman watching this show who's hurting, who physical therapy and shots, all that stuff you had is not
Which
helping,
I had.
but she's still afraid? What would you say? She's going to say, I'm too old to see a chiropractor.
You're
What would
not
you
too
tell
old.
her?
She's not too old. I'm going to be 82. And I'm old. So if I'm old, you shouldn't have to be afraid. You've got to come in and sit down and talk to the gentleman that's sitting right here, Dr. John, and see what he has to say. But as far as you getting hurt, he is not going to hurt you. It's like the doctors make them like they're enemies. Let's use that.
Yeah.
Because this is what they do, but it's wrong. Your age has nothing to do with it, and you'll be perfectly fine. You got to come in and sit down and let him see exactly what's going on, and you'll find out that he's going to help you more than destroy you like the therapists are doing. They're pushing the therapists, but they won't push the chiropractic because they're bone crushers. I'm going right back to that again.
Yeah.
They're wrong. The doctors have got to start a push chiropractic on people that need it and not the therapy that they want them to have. So this puts you in a bad position. So do not worry about your age. Like I said, I'm going to be what I am. And thankful to God to him, I'm up moving around. I feel good. I owe it all to him.
Okay, well, we got to wrap up this segment. But so in conclusion, if you're on Medicare, chiropractic is covered by 18 visits a year. If you're getting elderly, look for a gentle chiropractor. Not every chiropractor is the same. And if your doctor doesn't refer you, maybe it's because other patients were hurt by rougher chiropractors, so then you take it upon yourself to just give us a call, no referral. Let's go see now what the adjustment looks like. I thank you for taking your time in your busy day to be with us. I mean that. But what I'm about to show you is critical. I could tell you stories of people that call me from out of state that are not getting proper care, this is the care that they need. So we call this a high-low table. John lays on his stomach. He's going to put his hands up here. So if you're 95 years old and you think you can't crawl on and off, you don't have to. The table does the work for you. So John, lay on your stomach. Put your hands up here, just like we did from day one. Now down we go. What I'm about to show you looks so simple, but it is so powerful. And most chiropractors don't do this. I'll use this spine as a visual aid. The two main weight-bearing joints are called the right and the left sacroiliac joints. I remember when I was younger, I heard that term sacroiliac, but it is so crucial. In John's case, for 6 months, his right sacroiliac joint was like this. When the physical therapist measured his legs, they looked at them when they were like this. But the test is when you bend the legs, that's when I could see how far it's. So this man was like this. The more they stretched him, the more they exercised him, the medications they gave him, nothing. In fact, he was getting worse. He wasn't even getting better. So without his doctor's consent or without his doctor's referral, he comes up to me from the friend that you watched on today's show. As I measured his legs, his right leg was 1 inch longer. I expect it to be level today because he's been here about 8 times, but it's a process. So my job, I get on the right and the left and we shift it little by little by little. The angle of my elbows, how much tension, all of those little details are so important. If a man gets this back of an 82 and just crunches it like some chiropractor, and most chiropractors never measure the length of the legs, when you ask them, they'll tell me, well, we just crack both sides. Research shows it ends up right where it starts. John would have still had a right longer leg. So let's measure now the length of his legs. I expect them to be level. This simple test is crucial though. I always want patients to have their shoes on because I want to see how flat it is. Now it starts perfect, and it is perfect. So he's fixed, like he said. But so if you can envision, his right one was 1 inch longer, let's say about a month ago. So then this table I use, it's called a drop piece table. Not every chiropractor has this. It's the most expensive tool I could buy. You know, John was a mechanic. If a mechanic has good tools, he can get better results. I'm a body mechanic. So if I got his arthritic degenerated discs and I twisted him, he would have gotten worse. Maybe that's why some doctors don't refer to chiropractors. But I hope even doctors watching this show, we get this lever. I just elevated the pelvic drop, it's called, 1/4 inch. I'm going to get on his right and on his left. It's going to be 3 gentle little taps. But the angle of my arm is pushing this way. The angle of this arm, my line of drive is going that way. Those exact, what if I stood up too tall? All those little details after 44 years, it's like a woman baking a cake. She's going to make a pretty good cake after 44 years. So all these little angles, and we just sort of stand and get a little tap. No cracking, no twisting. When people watch me, they'll have their video phones on and they'll be thinking, I didn't hear anything. He didn't even do much. But if you can envision, the right leg was 1 inch longer, and then you recheck it and it's level. People, they get so excited because they're like, what did you just do? So we adjusted him. We told him to put ice rest. The mistake, don't go for walks. Don't use a vibration chair. Don't use any kind of therapy. It's so damaged. It's so weak. Ice and rest. He came back on the second visit. I think it was right back out again. Just getting in and out of a car, putting on his shoes and socks. We adjusted again. Maybe the third visit, 1/2 inch off. The fourth visit, 1/4 inch off. The fifth visit, it stayed. Now we're keeping it there. We're going to make sure it's nice and stable. Then very soon we're going to discharge him. He still has about maybe 10 visits left. He'll just call me maybe in 2-3 months if he shovels a foot of snow, because he's a feisty kind of guy. So if he shovels snow, and I love a self-made man like him. Our country was built on people that are hard, strong people. So I gently challenge you. I never believed in chiropractors. I heard all the stories of how rough they are. Many medical doctors, maybe they're afraid of our competition. Maybe they're afraid we're going to hurt the patient. But if a doctor was watching this show, if John's doctor, who did not send him here, was watching this show and said, I never knew there was a drop piece table. I didn't know that the chiropractor was more gentle. If we change John's life, to me, there's 100 people out there watching this show that are 85, 90 years old. They have stenosis, degenerative disc disease, or you name it, I've seen it. You could still be gently adjusted. So we tapped him, and then we rechecked his legs. So every visit, when he comes here, again, just to show you, it's such a simple but profound test. You must bend the legs to 90 degrees. So if a physical therapist or a chiropractor just looks down, it's not enough. The pelvis changes as you bend the legs up to, and again, not this far, that far. And so John's feeling fine. He has the same stenosis, the same arthritis, the same disc degeneration that he had before he met me. But because it's in proper mechanical alignment, all that stuff has settled down. So we're done with the visit. We bring up the table. Your feet are on the platform. So John, I know you said it earlier, but that's the same gentle process I used for you.
Absolutely.
And it never hurt at all, did it?
No, it does not hurt.
Yeah, so
It's a simple thing.
Yep.
All they have to do is come in and let them check you out.
Okay, so thanks again, folks, for giving us your valuable time. I mean this. I will never retire because it's a joy touching people's lives. So call me if you need a nice, gentle adjustment. Thank you.